Hi everyone, my name is Blessings Tezemu Kamanga. I work for the Ministry of Health in the Digital Health Division as a DHS2 programmer. I am going to present about One Health surveillance platform and how it was scaled up in Malawi as a response to COVID-19. So the concept of One Health surveillance platform was derived by considering that in life there's an interconnection between people, animals, plants, and their shared environment. Therefore, whatever affects the people and animals in one way or the other affects their surrounding as well. Hence, the concept of One Health, which involves collaboration between several sectors and applying transdisciplinary approaches at all levels, be it at the community level, district level, national level, up to the global level, with the aim of achieving the optimal health. So in all these sectors, we have surveillance, and the idea is to integrate all these surveillance into one. So in Malawi, One Health surveillance platform was implemented based on DHS2, and we have had several use cases, more especially during this during the COVID-19 era. So we had several implementations. These ranged from the point of entry screening program. This one targeted those entering the country from abroad. So this was targeting all the ports of entry. And what was happening was that whoever was coming to the country was being screened to ascertain whether the person has underlying COVID-19 signs and symptoms or not. So in the event that the person has signs and symptoms, the person was being enrolled into another program, which we are calling the case-based surveillance. So for this one, it had several stages. So first stage is whereby we're capturing more details about the person who has the signs and symptoms. So this involved the whether the person has the underlying conditions and the like. And then it was after the physical examination, it was determined whether there's a need to take a sample to the lab for this person to be tested or not. So when the specimen is taken, the person was also being tested. And then when the results are out, they were entered into what we call the National Laboratory Information Management System. And then there was a direct integration from that system to the case-based surveillance in order to have the results associated to the person from where the specimen was collected. And in the event that the person has been found positive, there was another program which we were calling contact tracing. So for this one, the person who has been found COVID-19 positive was asked to specify the people whom he or she has been in contact with. And then using that application, we're able to enter the details about all those people who are in contact with that person. And then those people were automatically suspects, and then they were being enrolled into the case-based surveillance program. And then the process continued like that. Then apart from tracing the contacts of the people who has been found positive, there was also another program which was focusing on the confirmed case management. So this was looking at the person who has been found COVID-19 positive, what sort of treatment is being provided to that person on a daily basis, and whether the person is still manifesting some signs and symptoms or not. And then eventually there was a component to do with the outcome of that person. And then there was also a time when we used the One Health Surveillance platform for conducting the school assessment. So this was a time when there were some measures which were being implemented to ensure to curb further spread of the COVID-19. So one of the measures was to close the schools. But then before the students could be released into the community, there was a need to ascertain whether the community was being put at risk by releasing the leaders or not. So this was a nationwide assessment whereby all the boarding training institutions were assessed. So this was looking at whether pupils or teachers have been tested for COVID-19, and out of those, how many have been found positive, and whether the school is following the preventive measures, and so on and so forth. And then the other program focused on the health worker risk exposure. So this one was based on the standard World Health Organization questionnaire, which was developed. So this really focused on assessing whether the health workers were being exposed or not. And in the event that they were being exposed, what sort of measures were put in place to mitigate the exposure? And then there was also under the World Health Organization questionnaire, there was also another program which was configured based on that, which we are calling confirmed case investigation, which was also focusing on what sort of treatment as the health worker who has been found positive received. And then finally, after having the COVID-19 vaccine, we developed a program which we're calling COVID-19 e-vaccine registry. So this one focused on registering all the people who are being who be receiving the vaccine, as well as ensuring that if those people develop adverse events following immunization, we are able to track, to say who are these people, and then what sort of vaccine were they given, and then what sort of IF have they developed. So all these programs, in terms of implementation, they focused on to ensure that they are implemented in all the areas. So the focus was to ensure that we're able to use the mobile phones, more especially in the areas where we have internet connectivity, as well as electricity challenges. So in terms of that, one could use the phone using the Android capture, connecting to the One Health Surveillance platform for entering the data. And then in terms of analysis, one is free to use the web version, where you are able to view it on the wide screen to view the graphs and the like. So for the phones, these were distributed to IDSR focal persons in all the facilities, thanks to partners and donors who brought in funds to ensure that the phones are procured. And then after the implementation, we needed to ensure that we provide the data for decision making, and there are several dashboards which were made for each of the implementations that I've mentioned. So here is a sample output. So this one is looking at is from the school assessment that was conducted. So like the first graph is looking at the number of learners who were confirmed to be COVID-19 positive by gender. So we have a proportion there for female, which is 62%, and another for male, which is 37%. And then to the far right, we have another graph which is showing the number of tests that were conducted, and then the number of cases that were confirmed, and then the number of deaths, as well as the number of recoveries. So you can see that at the time when the assessment was being conducted, that was in February, we had no deaths, but we had number of cases which were confirmed, about 1,479. And then out of that, we had about 785 recoveries. And then another sample output. This now is from the COVID-19 vaccine register. So this one is looking at the number of people that have been vaccinated in the last 14 days. This is as of the 15th of the 15th of April 2020. So we have those numbers, with the highest being on the 12th April 2021, which is about 7,521, and then the lowest in the last 14 days being 841. Okay. Apart from that, on the dashboard, we are also able to have the number of people that have been vaccinated by district. And then you also look at how many facilities, in how many facilities are these vaccines being administered. And then on a daily basis, you are also able to check how many records have been entered. So there are these and also several other visualizations that are included in the dashboards to ensure that managers are provided with all what they need to ensure that they make informed decisions. And then in terms of the next steps, since this was in response to the COVID-19 pandemic, but there are also several other needs that may need the use of the One Health Surveillance platform. So thus there's a need to develop more tracker programs to ensure that they fit to those different needs. And then apart from developing the other tracker programs, we have to ensure that we monitor the usage of the already existing tracker programs and support wherever possible. So if people are facing problems with the gadgets or with the program itself, we have to ensure that we provide the needed support. And then not just capturing the data, but we have to ensure that the data that is being captured is of good quality. Hence, we need to come up with more data quality improvement plans, as well as having the data review meetings to ensure that people learn from each other in terms of the challenges and how they are resolving those challenges. And then lastly, since as I indicated that One Health Surveillance is multi-sector approach, since whatever we have applied, I was applying to the health sector, but then now we have to ensure that we apply whatever knowledge we have gained, the experience that we have gained in the health sector, we have to apply that in the other sectors. So for instance, we have the agriculture sector. So we have to ensure that we should also be able to develop some tracker programs that will respond to various needs that are there in the agriculture sector. And indeed, another sector that would require such kind of innovations. Thank you very much. This marks the end of my presentation. I would now invite comments or questions if there are any. Thank you.